Thank you very much, Rochelle. Hi, everyone. I'm Mandana Khalili, Professor of Medicine and the Director of the UCSF Research Coordinating Center's Investigator Development Unit of the NIMHD Health Equity Action Network. I'd like to welcome you to this very special virtual session that involves all of us Sandbox in collaboration with the Interdisciplinary Guided Network for Investigation, Translation, and Equity, or IGNITE, and our community center P50 grant holder. We have Nikisa Parky and also Dr. Elizabeth Cohen here with us to assist us with this session, and we welcome you all. And Nikisa, we are honored to have you here and look forward to this presentation.
Thank you so much for that lovely introduction. Dr. Cohen and I are so very excited to be part of this opportunity. We'd love to introduce the All of Us program to you and give you a little bit of a deeper dive as to what the program is and how you can maximize the data set to conduct your own research. So with that, we'd like to give you a little bit of time to complete a survey for us. It'll be very brief. If you can, just either scan the QR code or use the link, that would be wonderful. I will also include the link in the chat for you. And this really helps us to determine if the session was beneficial and how we can modify the session for the future. And thank you so much, Rochelle, for including that in the chat. So we'll just give everyone a couple of minutes. Okay. So since it is a brief survey, we'll go ahead and continue. The link is in the chat. If you haven't finished it just yet, you can certainly do so as we start our presentation. All right, so a little bit about IGNITE. We're the Interdisciplinary Guided Network for Investigation, Translation, and Equity. And a little bit about our mission and vision. So we are a program working with the All of Us Research Program, an initiative led by the NIH. And our purpose is to increase the diversity of researchers accessing this All of Us data workbench. And we ultimately hope that increasing researcher access will contribute itself to the science of community engagement and ultimately improve community health. We want to become a nationwide model, which is one of the reasons why we are launching this virtual method of our data sandbox, which we've previously done in person, but we recognize the need to branch out and reach those who are in California, for example. We're really working to engage those who are traditionally underrepresented in biomedical research and to also engage with researchers who either are early stage investigators or are from minority groups themselves. This is a little bit about our engagement model and what we do. Today, we're going to be doing the data sandbox, which is this top description on the left. We do these presentations and tailored activities with groups that are interested in similar backgrounds of research. For example, we've done so with social workers, clinical nurses, genetic counselors, health commissioners, and community-based organizations. And we found that the session is very successful in starting the first phases of learning about the All of Us research program. We're also very excited about this launch of the Touch Health Fair, which focuses on returning value to the community using this data. So hopefully using the data set will lend you to also return value to communities through impactful and meaningful research. Again, a little bit about what our role is. So we at IGNITE are located within the Northwell Institute. We partner with Hunter College, Pyxis Partners, Columbia University, and PAGNY. And our main role is to link this All of Us research program to community-based organizations, researchers, and community health workers. So this involves a lot of capacity building and presenting data in a way that can be accessible to all. We're hoping with this sandbox, we'll demonstrate the power of the program, show you how you can contribute to better health for all, and spark some ideas about what research you may wish to conduct yourself. So a little bit about the All of Us research program. The research program is hoping to invite or enroll at least 1 million participants. It is the largest and most diverse biomedical data set of its kind, and the most impactful part of this data set is that it is representing those of communities that are traditionally underrepresented in biomedical research. So that's about 75% of participants are underrepresented, and 45% are from racial and ethnic minority groups. And you can see here, there's over 700,000 participants enrolled in the study, and we have data from EHR records for approximately over 400,000. And this data is old. It's as of April 2023, so we know the numbers are even higher. Its mission is to, again, deliver one of the richest biomedical data sets of its kind, to catalyze an ecosystem of communities, researchers, to use this All of Us research program to, again, ultimately improve community health, and to also nurture partnerships with these, not only individuals who are donating their time and their information, but to also community-based organizations. So the 5-year goals that we're mainly involved in is, again, bringing this data to researchers and researcher access and impact. I will not bore you with all of the focuses, but these are the 2 main functions that we're hoping you will participate in with us. So some of the research discoveries that drive this precision medicine approach is that we are engaging with people and communities, again, who've been left out of biomedical research. We're combining biological factors and the social determinants of health through some very large scale and impactful social determinants of health surveys. We'll follow participants as they go, and we make sure that this data is easily accessible to both researchers, communities, and community-based organizations. This is a little bit about how it works. And while we are not in the role of enrolling participants, I do want to make sure that you're aware that anyone can visit this research hub data browser public iteration, but there are also iterations of the program where you can register as a researcher and have increased access to EHR record concepts, analysis that you're able to do. And then we do have our research projects directory, which is, I think, one of the coolest parts of the researcher hub. Again, we've already discussed this a little bit, what the program purpose is and who we are hoping to target with this data set. Again, it's those underrepresented in biomedical research, and also those researchers who have traditionally been underrepresented in the work that they're doing. Okay, so the promise for researchers. I always like to highlight this because I'd love to demonstrate the capacity of the program for researchers. It's a rich source of data, as we know. It includes biosamples, electronic health records, participant surveys. It's a longitudinal data set. It's a diverse cohort of participants, and it really represents the country, not just the select participants from a certain population. It's really looking at rural groups, those of ethnic minorities, racial minorities. It's data that's already cleaned and curated, and it does have robust computing and analytic tools. It's a group of engaged participants who are also eager to participate in ancillary studies, and it's very useful for researchers in that they can share their workspaces with other researchers and collaborate and foster partnerships. And right now we have, this number is actually very outdated, I think, over 2,800 researchers so far, and over 385 institutions. Again, this is just from April 2023, so I know these numbers are much higher now. Again, one of the greatest perks is that you do not need IRB approval unless there is a specific institution requirement, but even that is certainly for expedited review. And all patients have already consented to participate in this research program. And as you may know, if you've conducted your own research endeavors, IRB processes are not the most fun. So again, we are showing you the incentives and benefits to using this program. It really is a disservice not to. This is, again, just highlighting what the process is for registration if your institution does not have a data use agreement in process. I'm more than happy to help anyone if you go to the researcher workbench and find that your institution might not necessarily be there. But this is just a little bit about the process, and it is very accessible. The DRC is very willing to work with organizations to get them onboarded to this researcher workbench. I just wanted to highlight some of the amazing research that's being done and also the broad depth of the research being conducted. So you have things all the way from cardiovascular risk to HIV, to glaucoma, to looking at Latino and Hispanic populations, and studies about breast cancer. So there's so many facets of this program that you can look into depending on your research interests. Here's a little bit about our partner networks. So you can see things like the Black Women's Health Imperative, APHA, 50 Forward, NACHO, the National Alliance for Hispanic Health. It's just a very comprehensive program that's really hoping to include a lot of community-based organizations. And here are some of our consortium members. So here in New York City, for example, we've got Columbia, Cornell, NYC Health and Hospitals, Harlem, and I know that California also has a large network as well. So what kind of data is available in this research program? So the types of data and the sources are survey responses directly from participants. We have over 400,000 surveys being responded to. We have things like physical measurements, genotyping arrays, and genome sequences, as well as structural variants. So if genomics is something of interest to you, you should definitely look into this program. I can't think of any other program that has this kind of information available and this amount of information available. Another very important facet to this program is the number of EHR records that are pulled from participants. We have close to 300,000 EHR records. And again, I think this number is even higher at this point. And one of the most new and exciting things is Fitbit records for over 15,000 participants. Just wanted to go over a little bit about how you can access the data and what data is available according to the tier that you're registering in. So the public tier, which is what we're going to be looking at today, gives you an aggregate view of the data. It's a great place to start to look at what variables are there, what conditions are there, very high-level numbers, and a great breakdown of the numbers by gender, sex, and age. That's what we're going to be focusing on today, but I do want to also make you aware that the researcher workbench is where you can access the in-depth data and access a variety of research tools to conduct your analysis. So there's where you can find things about surveys, EHR records, physical measurements, and wearables. And then there's the next tier, which is control tier. It's an additional training. I believe it's a 1-session, 45-minute training. And that's where you can access things like genomics. Again, this is just a view of what you're able to access and what functionality you have within each tier. This is some of the information related to genomics. For those who are interested, again, we just put this in to incentivize and excite you if you are a genomics person. So what kind of surveys are there? That's one of the most exciting parts of this data set is that we are gathering participant information directly in addition to their EHR. So we have things like the basics, overall health, lifestyle, healthcare access and utilization, personal health history, as well as family medical history, the social determinants of health, which I think is one of the most important ones. And we also have 2 surveys related to the COVID-19 experience and COVID-19 vaccines. Like I said, I think the social determinants of health is one of the most exciting surveys that we have. And again, it includes such a large and inclusive scale. We have things like neighborhood safety, things related to discrimination, food security, English proficiency, housing, and healthcare discrimination. So it is a very valuable survey. And here's just a little bit of a look at what the COVID-19 participant experience survey looks like. Again, there's several different questions related to this module, things on mental health, things on social distancing, COVID-19 symptoms. So if this is of interest to you, it is definitely worth accessing and exploring this survey. So there are some advantages and limitations. Liz always likes to call it the all of us disappointment syndrome that you might have. So we just want to let you know that there are, of course, some limitations, but you can see here the advantages side is much more robust than the limitations. Some of the limitations are that there aren't environmental data at this time, and there is a potential learning curve when you're doing the actual analysis. You may have to know R and Python to do these analyses, or we're really working to promote within your organizations the partnership and collaboration with biostatisticians that you may have. But the advantages side are that there's such a wide range of diverse participants. It is participant-provided data, it's broadly accessible, and that new data is regularly released. And again, I just want to highlight that no institution or individual could really hope to enroll at least 1 million or more participants, not have an IRB for it, and already have the data cleaned and curated. So again, it's a disservice to yourself not to use this platform. A little bit about those research tools we discussed. So what kind of research can you do with this? You can do prospective, retrospective, and cross-sectional. You can look at things like risk assessment and preventative strategies. We are hoping to increase wellness and resilience with this platform, and look at new precision treatments and interventions, as well as investigating health disparities. So there's a lot of research potential here. And again, this is a look at the research tools. We'll look a little bit more into this later, but the platform itself, which is within the Researcher Hub, which you will need to register to access, has a wonderful interface where you can develop actual cohorts, select variables of interest to you. For example, select diabetes diagnosis, select either male, female, other, select age ranges, and really use the program to select those variables of interest to you. And then to ultimately run it through the notebook or Python to conduct analysis. So who's using this workbench right now? Anyone can really use it. So we like to highlight the fact that data scientists are definitely using this, but we also want to highlight that early career researchers and students are also using this platform. We also have health equity and health disparities researchers. Again, I think that this number is outdated now because it's from November, and the numbers are consistently and regularly increasing, but over 600 institutions are involved in the program, including historically Black colleges and universities and Hispanic serving institutions. I know this number of registered users is outdated, but as of November, there was about 7,500 registered researchers. And again, I know this research project's number is also outdated. I believe we're closer to 9,000. So you can see that this number is continuing to increase and demonstrates its usefulness. And again, just looking at some of the advantages and limitations, not to the data, but to the actual research tools. We already discussed this, but there are some limitations with R and Python, which is the coding software needed to run some of this analysis. But we are seeing that people are able to think outside the box in terms of partnering with biostatisticians in their own institutions. And some have even taken courses in R and Python. I always like to point out that there is a user support hub for resources. They are very helpful. you can enroll in All of Us research hours. We are actually at Ignite conducting our own Friday morning coffee series, which I would be happy to disseminate after this presentation, where we cover various topics. And we also have a Q&A every other session so that participants can come in with specific research questions related to their projects. And we have our two amazing biostatisticians who join us during those sessions to give live feedback on those questions. I also love to point out that there are funding opportunities with All of Us. Researchers who use the data set are eligible to apply for some of these funding opportunities. Here are some of the examples. And again, they're very wide ranging, so that's something that you can visit on the site as well. So some research spotlights and a little bit of a look at the research projects directory, which I think is so important, again, as you're starting to explore this data set and see how you can maximize its use to conduct your own research. So this research projects directory, as I said, the last slide was very outdated. We do have over 9,000 active research projects. And the great thing is that you can search for research projects here. You can search by potentially institutions that you're interested in, researchers that you might be aware of who are working on certain projects. And if you click down on each of these research active projects, it'll give you a breakdown of what the research program or the research project actually is, what they're hoping to find from it. It gives you the names of the contacts. So a very great resource. And then we also have, again, this is an example that I put in here. We looked for cardiovascular for today's session. There's 103 active projects when searching for the word heart, 105 active projects, and myocardial was 4 active projects. So it's, you can search by various keywords and find a wealth of active projects. And then we also have the publications directory. There's currently 228 publications, and I don't think that all the publications are even listed here. So we know that there are many researchers who are using this platform, again, to conduct research.
Nikisa, I apologize.
Yes.
Can I ask you a quick question?
Absolutely.
There's a question in the, thank you. There's a question in the chat regarding Dr. Danish wants to know if there is mortality data with cause of death being available in the database.
At this time, there is not mortality data. I believe that they are looking into it, if I'm remembering correctly, according to my biostatistician, but that's a question I can definitely look into and let you know after the session. But at this time, I do not believe there's mortality data.
Yeah, and I'm sorry that we are working on it, and I'll try to work also the questions in the chat. We are working on linking it to mortality data. It is coming. It is in the near term. It is coming in the near term. Record, is it possible to do a record linkage to find out about it? Okay, I'll you know what, we'll group all of the record linkage questions to the end, and then I'll answer them all together.
Wonderful. Thank you, Liz. Okay, so again, I just wanted to show some of the examples of publications, and this is really just for you to see, again, all the different kinds of research projects that can be done. Again, we can look at things related to socioeconomic and racial ethnic disparities. There's things like antibiotic prescriptions, blood pressure, things related to social determinants of health, cannabis use, COVID-19, and daily step count. It's just a very comprehensive data set. So how to use the All of Us Researcher Workbench. This is a presentation that our biostatistician Shaya Muhammad usually presents, but I do like to always include it just so you can get an idea of what the process looks like to conduct your own research program. So when you're creating your data set, you're looking at a research question, you're defining inclusion and exclusion criteria. Again, using these concept sets where you're selecting your variables, as I discussed a little bit earlier. You build your data set according to your research topic of interest. And then the last step is exporting this through Python and R, which is the coding software. This is a little bit about what it looks like to create your data sets. You can select these cohorts of either all participants or participants who've been diagnosed with a certain condition. You can look at things like language or, health insurance, social determinants of health. It's a very user-friendly workspace. And then you can export your data set to create a new notebook that ultimately will allow you to select your programming language of Python and R. And this is a synthetic view of what the descriptive data summary looks like. Again, you have your cohort definitions, and your exclusion criteria, inclusion criteria, and here's a nice little summary of the number of participants you have. So the conclusion of when you're making this research project is to look at the data browser, which is what we're hoping to do today, to kind of spark that interest, see what is available, ensure that your topic is available, like we said in the data set, make sure that the number of participants available for your study is of value. There is a clause that if there are less than 20 participants in the study related to your variable or topic of interest, unfortunately, there is not a way to conduct the research for that, as it may be linkable to the participants. So just something to keep in mind. Defining your research question and having careful consideration for those sample exposure and outcomes to answer a clinical question of interest, and to also make sure that you're not doing research that is stigmatizing, and to always conduct research questions that are, again, not biased or stigmatized. So a look at the public data browser, which is what we're going to be focusing on today's activity. So when you go to the researchallofus.org page, here's what it looks like. You can go to the Data and Tools tab where you have the data browser. This is what the data browser actually looks like. The domains of interest that you can look into, we have things like conditions with over 25,000 medical concepts alone, drugs exposure, which is again close to 30,000, labs and measurements, procedures, and you can see these are all pulled from EHR. So there's a wealth of medical concepts in each of these domains in the EHR. And then there's also the survey questions, the 8 survey questions that are participant answered. We have things like the basics, overall health, lifestyle, healthcare access, and the social determinants of health, as well as the COVID participant surveys we discussed earlier. And each one does give you the number of participants who've answered this particular survey, as well as the number of questions within each survey. And again, when you go back to the landing page for researchallofus.org, you can take a deeper look into the Survey Explorer. You can actually download these surveys and have the PDF version of all questions that are asked. This is a little bit of a look at the Survey Explorer when you're doing a deeper dive. And you can see again here, you can download English versions or Spanish versions of these survey questions. So we're going to dive into the Data Sandbox activity. Let me go ahead and give you instructions for how to do this. We're going to be breaking out into breakout rooms and groups to do this activity. It is interactive, so that we hope that you'll work with your team and answer these questions. It's a bit of a treasure hunt. So if you go to the data browser, I'm going to go ahead and include this link. This is where you will find your questions. I have the groups here. So our group is a little bit smaller than anticipated. So let me quickly calculate how much we'll have in each room. We'll try to go to data browser here. And this is where you can access, again, the domain concepts for the EHR, things like the survey questions we looked at a little bit earlier. But when we're looking at data sources, here are the kinds of data that are collected by the program. So we have EHR records, biosamples and bioassays, genomics, surveys, physical measurements, and wearables like Fitbit. And actually, I'll do a couple of other questions together as well since our group is a little bit smaller. And please feel free to follow along. And if you find the answers before I do, put them in the chat or unmute yourself. We really want to make this activity a group effort. If I don't hear the answers, I will call on you. So no pressure. The second question we had is how many participants are enrolled in California? So again, when we go to data and tools, we can go to the data snapshots tab, and the data snapshots again are looking at the overall numbers. So we can see here more than 1 million people have registered with the program. Participants at a glance, we have over 700,000 participants and data from over 500,000. But as we continue to scroll down, we can see some of these broad numbers. Again, the map has this great function where you can hover, and for California, which is the most densely participating state, we have over 71,000 participants. So that is great. So if you're in California and you're interested in doing information related to your state, this is a great place for that. We can go to question 3, or we can do the breakout rooms if you'd like. Let me know what works best. Ed, what do you think? Or Mandana, what do you prefer?
I think we can now divide into groups.
Okay, wonderful.
Right?
Yeah. So we're basically kind of like clicking through that, in that in the up the data and tools, the various sections. That's kind of where we're hunting for some of these answers and things like that.
Exactly. So, this is the cheat function, is the keyword search here. So you can either do that, or if you know, for example, that you're being asked to look up a certain condition, you can go into the conditions tab and look through here. You can type in something like, I didn't want to give away one of the answers, but I will give a little hint for those who are paying attention. For example, you can look up diabetes. So I'm going to go ahead and start the breakout rooms. Feel free again to answer the questions that you'd like, and we will all come back together in 15 minutes. I'll be hopping around the different rooms to assist in any way I can, and then we'll all come back together. Again, the activity wasn't necessarily to find the correct answer, but for you to see what's actually there as you look through the data set. So we can quickly go over some of these questions. I know that not everyone was able to go through all of them. And then as we do these questions, please feel free, first of all, to unmute yourself, blurt out the answer, put it in the chat, and ask questions as we do this. I really want this to be, more of a conversation than a presentation at this point. So the first thing we asked, which we did together already, was the data sources. We discussed it: EHR, biosamples, surveys, physical measurements, and Fitbits. We talked a little bit about how many participants are enrolled in California. Some information on where you can find summary snapshots. So the next question we asked was how many participants had the COVID-19 vaccine. So if anyone knows the answer to that, I know someone does because we did it together. Judy and Ahmed, I think. If you know the answer to that, that would be great.
It was 50-something%. Ahmed, did you still have it up?
You are right.
Yeah,
you're right. Your memory was right. So there is a COVID participant experience survey where we ask some of these basic questions. Did you receive the COVID-19 vaccine, of which 56% said yes. The next question we asked was
said no.
I'm sorry.
56% said no. That was
that's what I meant. Yes. 56% said no. I wish it was a little bit higher, but that was still at February 2021. So maybe the number did go up. The next question we had asked is what % of participants speak a language other than English at home? Was anyone able to find that question?
Yep. Amanda, you want to give our results?
Yeah, it's 13.4%.
You are correct. And one thing we were talking about in one of the other breakout rooms is this thing called proxy playing. So if we can't find a variable directly related to, for example, if a participant is an immigrant, which is not asked, again, because we don't want to stigmatize or make participants feel uncomfortable answering a certain question, one thing that we think of is, well, if they speak a language other than English, perhaps they are an immigrant. So, again, this is a great way of what we call proxy playing, and 13.4% is correct. So the next question we had was, what percent of participants were diagnosed with chronic kidney disease, and what age group had the highest percentage? So did anyone get the answer to that?
Yeah, we got 10.88%, and then the age group is 60 to 69.
You are right. So 10,340 participants were within the age of 60 to 69 with chronic kidney disease. And again, the main point of this question was so that you can see that when you go to the conditions domain and you type in chronic kidney disease, it'll give you a bunch of different answers that you can then select from, which is the exact condition you were hoping for. So question 7 asks, when asked about your annual household income from all resources, or rather all sources, how many participants reported, I believe, 10 to 25,000? Anyone with that answer?
It was like 47,180.
You are correct. So that's about 11.52%. And again, we're highlighting what's available in the basics survey, which do include things like annual income and other questions related to, for example, the basics of housing. I think that there's a question on whether you have insurance or not. So the next question we had was, how many medical conditions have been identified across all participants in their EHRs, and which condition is documented the most across all participants? Did anyone get this one?
That was a little, it was what there are certainly like 25,638 concepts, but like if you want, a lot of those are kind of overlapping as well. So, the conditions, that they're actually, those are actually concepts, which I don't know that people would normally consider a condition, so we couldn't necessarily find, the high level conditions where you group a lot of those concepts together, but certainly there's 25,000 concepts.
Yes, so you're right in that regard. And again, I wanted to show this domain because while there is 25,000 medical concepts, one thing actually that Mandana and I found together is that, for example, if you type in liver disease, you'll have a different number of variables than simply the word liver. So again, this is playing around with the data browser, entering in one word and entering in another word that could be relevant to see, again, to really refine and hone down what you're looking for. So when we do the broad look at all the conditions, you can see that these top ones, again, they can be a little bit of an overlap. So we have pain as the top condition, but we also have pain in limb. So this was really a trick to see, for you to understand that some of these do overlap, but there's also room to, again, proxy play to find a word that might be similar. So it's a little bit of a treasure hunt.
Nikita, can I just ask a question? Oh, sorry, go ahead. Somebody had a question before me.
Oh, just really quickly. When we were playing around with the search function, the search bar, we couldn't search, or at least we weren't coming up with more than two words that would bring a result up.
Yes.
Is there like a specifier that one has to use, like pain and limb, or we were trying to look for alcohol disease or alcohol abuse, or that kind of thing. So we got a bunch of results just using the word alcohol.
Yes.
But then when we try to specify like drug related alcohol, like ETOH didn't come up, alcohol abuse didn't come up. Do we have to use specific specifiers?
You may in the medical concept. So certainly if it's something that's diagnosed, you may have to look that up. For example, if you're looking for alcohol abuse that leads to liver cirrhosis or, something clinical like that, I'm not a clinician, but that's, again, something that you have to do a little bit of playing around. That is that caveat with the All of Us data set, that it is so wide. We do have these 25,000 concepts, but you do have to do a little of playing around to find the exact variable of interest to you. And one of the incentives for the workbench is that you're able to do cross analysis between two variables. So if you wanted to do alcohol use and liver cirrhosis, for example, or a medication that could be prescribed for example, maybe drug use and methadone or that kind of thing. That's where the workbench really comes in handy to do this cross analysis of two variables that could potentially be related to, for example, alcoholism or drug abuse.
Got it. Thank you.
Yeah.
Nikki, I have one other question. Sorry, you were
yes.
referring to, for example, this pain concept, pain being the first one, and then there's overlap, of course. My question is the database itself capturing anything with pain and then the subcategories of it so that you could you'll see the overlap, or is it that the medical record in one place says pain, in another place says, joint pain, in another place, and then they're all, it could be the same person represented several places.
I actually have the same question. Go ahead, continue.
That's it. That's all I wanted to know.
Yeah, I was actually thinking of that. And I have to ask my biostatistician because this is a little bit more of a detailed question about how they organize the data. I'm going to ask Shai Muhammad. He's amazing, and he definitely knows the answer to this. And I can email the group with this answer because it is a good one. I don't want to tell you the wrong information and lie to you.
Sure. And Edwin has done some additional training. And do you know if there is any? Do you have any thoughts about what I just asked?
Oh, well, they have, so there are levels to, to the concepts, et cetera. There's, it depends on whether recoding has happened or not. So, but yeah, things get, in medical records, the way things get coded is often quite different. The repeated or overlapping within the same individual, from within the same visit is not that common, but you can get that, depending on how it gets written and gets coded in an EMR, you can have different codes. But
so you should have a study ID, right? That you can utilize and say, if you want to remove duplicates, for example. Is that correct? Nikki, so
yes.
Yeah.
I think when you're creating your cohorts, being diligent about all the possible concepts that are included in what you're after, I think is really important. So when you're in the cohort builder, in the registered or the controlled tier, just making sure that in your selection criteria when you're building your cohort, you've included all those concepts, either conditions or demographics or social determinant of health answers to the various surveys. That's where you put your effort in to make sure that you're capturing everything you want and removing those things you don't want.
That's exactly correct.
Thank you.
All right, wonderful. So the next question asks how many participants said that their information was easy to understand only some of the time or none of the time. I think this question is important because it refers to health literacy and is still a bit of a social determinant of health, but is in the health care access and utilization module. And this again shows that while you might not find this question in the social determinants of health, exploring a little bit and using this proxy playing can find you the question that you're hoping to answer in a different survey. So did anyone get this question? You might not have. Okay. So
I know we saw it in a different place, but thank you so much for
yes,
sharing.
Absolutely. So we asked some of the time or none of the time, and that's about 12,200 participants, or 5.7 and 0.71 participants, saying that some of their information was not easy to understand. Again, I think this is very important for recognizing health literacy. The next question we asked was, during the past 12 months, what % of participants reported seeing or talking to a mental health professional, such as a psychiatrist, psychologist, psychiatric nurse, or a clinical social worker? Again, Mandana and I
yes, I know you and I.
Yeah,
I think the point of this is really to, and I really appreciated your input there, Nikisa, is that you have to become familiar with the surveys itself, and
exactly.
not just go through the high level. What category they belong to in order to find those. Some are very easily understandable, that it's, it could be within zip code, it could be within your social determinants of health. But again, as you shared, health literacy, for example, pops up in the healthcare access and utilization.
Exactly. And really the point of the activity, like I said, is not to find the answers right now, but to find the variables, because at this level, aggregate data, while it's nice to see this information, using the workbench is really the incentive, because we can do this this cross-analysis of, for example, in African-American populations and Black populations, how many percentages of people have seen a mental health professional, and that's where you can do this analysis ultimately. So the next question is, again, doing a deeper dive of depressive disorder, mood disorder, and anxiety, which is in the Research Hub. And I think, again, this is very important to see. These, of course, are capturing this diagnosis in the EHR, but I like to point out this question because they have already started a mental health module, which we're very excited for them to formally make available to the public. But they are at this time doing the recruitment for that particular survey. And that really addresses those who have not been formally diagnosed. So again, we see 89,000 participants who reported in their EHRs or were diagnosed with a mood or anxiety disorder. And we can, again, when we toggle on this, we can see the percentages by sex assigned at birth. So 28% for males and 36% for females. So I'm not sure, again, where each group was able to answer the questions as we kind of shifted around. But the next question is, how many participants said that they sometimes are treated with less respect than other people when they go to a doctor's office or healthcare professional? Again, this is very much related to the social determinants of health, but this answer is actually found in healthcare access and utilization. And again, I'm not sure if you were able to find this answer. If you were, blurt it out, but if not, again, you can see that. Yes.
Sorry, Nikisa, can I just ask quickly, if we were to sort of search for respect, for example, that will pop up, is that correct?
Yes. Yes,
okay.
Respect will pop up, and it will show you the different domains that respect could be in. So I do know that respect is also in the social determinants of health, as well as the healthcare access utilization. So sometimes it might not be straightforward where it is, but that's also the excitement of going through the variables before you formally register to the researcher workbench. The next question is type 2 diabetes, which again, you'll see here again why we do this. We ask this question is when you go to the conditions and you type in type 2 diabetes, there's a bunch of different related conditions, and this is both great and could be potentially overwhelming for which one to choose. But when you're just selecting type 2 diabetes, we have 56,000 participants, or 22.12. And again, this is when we're thinking about exclusion criteria is, for example, gestational diabetes. That's something that you'll have to remove if that's not of interest to you. So becoming familiar with these variables and these medical concepts, I think, is very important. Number 14, when we're asking about lifestyle and electronic nicotine product use, again, we can see about 16% of participants report this. And again, this is something that could be a very important variable to look at, again, as you're selecting variables that could be analyzed with this. So for example, lung cancer and nicotine use, that's something that we want to incentivize you to research or workbench use.
Can I just mention one more thing, Nikisa,
Yes,
because we did
please
look
do.
at the lifestyle one, and I just clicked on the alcohol, thinking about, whether there's any different types of measures. And for alcohol, for example, it's just lifetime alcohol use. Yes, no. So, have you had a single drink in your lifetime? And we were surprised to see about 40,000 people said no, which I thought would be close to, very, very much lower than that.
Yeah, we were surprised.
So interesting, but again, depending on what your question is, it's not going to get at the nitty gritty of what you want to know. So using alcohol, you probably need more information. But those who never use alcohol, this will be an amazing cohort to assemble.
Exactly. I'm so thankful that you brought that up. We did actually go through these questions together. Again, this is another question where you can determine from the drug exposures looking at a specific medication. And if you're thinking of diabetes, but you're not finding the exact medical concept, perhaps something you can do is look at metformin use instead. So that's, again, what we call proxy playing. We have information on obesity as well, 31%, which is actually very very comparable to some of the actual data that we see from surveys related to, for example, New York Department of Health putting out their surveys for the 5 boroughs as an example. I'm going through these very quickly again because I want to give us some time at the end, but also show you the value of some of these questions. So, we ask in the family history questions like, has anyone in your family been diagnosed with things like blood cancer? But there's also so many other conditions in this family history section, things like other cancers, lung, things like related to GI, things related to, I believe, drug use as well. So again, very well-rounded and comprehensive set of information for family history. There's things like lab measurements where we ask things about body weight, and we can again toggle and see great aggregate data here when you are looking at the count for women, what the highest range might be, as well as the participant count within that range. So if you're interested in measurements, again, that's a great place to look. There's some information on myocardial infarction. And again, this is in the conditions domain. And you'll see again that there are several also known as, they'll suggest it for you, other things that you can search the term by to include as your variable inclusion criteria when you do your analysis. Participant counts for Fitbits. Just wanted to highlight that as of 2022, there's over 15,000 participants. So if that's something that you're interested in, that is a very sizable number of people. And again, this is from 2022. So we do anticipate that the numbers will come out shortly and be much higher for 2024. Just some questions related to the social determinants of health, participants being asked about neighborhoods having free or low-cost recreational facilities. And we did say that a limitation was environmental factors, or environment not being included in the study. But we do, again, have a little bit of proxy playing where we can ask whether the participants' environments are conducive to exercise or healthy living. And you'll see that about 33% said that they do have neighborhoods with low-cost areas, which, can again be used as a cross-analysis variable for obesity, for example. Questions related to transit. I really like this question. It's what % of people said they feel deep inner peace or harmony most days. And again, this is a proxy play. They don't ask specifically at this point, do you have anxiety, just general. They'll ask things like, do you have anxiety about paying rent or a place to live? But this asks really a question about your overall spirituality. And again, it just highlights how broad this information, this data set really is. And the last question was participants agree that people around here are willing to help their neighbors. And I think this is an uplifting number, 45%. You would think it's lower. So again, related to the social determinants of health. So those are all of the questions. Again, I mainly didn't want the answers, but wanted to show you ways you can play around with the data, the value of looking at the public data browser, and the value of going into the workbench subsequently to do the cross-analysis for these variables of interest to you. So I know we're almost at the end of time, and we do have a post survey that we'd love for you to complete. If you don't have time to complete it, or you have to hop off, I will definitely ask Rochelle if she can disseminate this to you. But are there any final questions at this point?
Maybe just, and Nikisa, if you don't mind, 1 minute for Edmund. I apologize for him to just share some of his experience as well as it relates to the ESIs. Go ahead.
Oh yeah, sure. You know, I again want to reiterate that I think this as a resource for early stage investigators is really terrific. You know, for developing and extracting data as pilot studies, in support of grant applications, for actually being a data source to write publications. As I mentioned, other heme ESIs actually have now published off of this data. I think as a way to generate hypotheses, just kind of exploring relationships. To get to that level, you do have to go to the register, to the controlled tier. The training, it takes, you know, about a day, half a day or so. But the training was really excellent. I highly recommend it. It was one of the better trainings in dealing with underrepresented and marginalized at-risk populations that I've experienced, and better than the ones that you know, that City gives.
Yes, that's exactly what I was thinking. City was woohoo, but yeah, no, you are correct.
They give better and more recent historical examples, you know, yes, beyond Tuskegee, you know, which is really helpful. Also, you know, it is a little bit of a lift when you get down to the analysis part. You have to do some programming in R, but your local biostatisticians can give you a hand with you know, writing code. If you're used to using things like Stata or something like that, they can help you translate that into R. And also, I've been using ChatGPT to help me write R code, or to fix R code that's broken. And maybe we'll have Will Brown give a seminar on that after his AI seminar that he's done. But anyway, I just want to encourage people. It's really worth the investment to build your skills and to have another resource for, you know, for helping to generate ideas. And to build your publication record, like if you've got time.
Exactly.
So those are the things I wanted to say about this, and particularly, you know, for getting access to a more diverse population. I think this is a terrific resource.
Ahmed, I see that you have a question about how often the data is updated. I believe it's once a year.
Okay. If there are no additional questions, I wanted to thank you once more, Nikisa, for an outstanding presentation and all the wealth of knowledge you provided us. We're very, very, very grateful. And we obviously have your information, and yes, we have recorded this session as well. So hopefully we can have a much more of our network having access to this information as well. Once again, really grateful for you.
Thank you all so much. It was wonderful. I know that there was a lot of information in a condensed period of time, but please do reach out. There is a lot of merit to using this platform. And if you have any questions or need any assistance, please let me know.
And the training videos that are publicly available through through all of us on what's in the workbench are really good too. There are actually there's a lot of video training that you can do on your own, just to see what's there, and they really can walk you through the whole process. So there's a lot of good support materials there.
Yeah, the user support hub is like so helpful, especially as you're starting. There's these good 2 to 3 minute videos, so it's not overwhelming, about how to make your cohort, how to go through the process, just very straightforward and helpful.
Thank you. And don't forget, everyone, the coffee house.
Yes, I will send that information as well.
Thanks.
Thank you.
Thank you
everyone.
all.
Lisa, bye.
Bye-bye.